In a medical malpractice case that's against a doctor, people often ask me, hey, Attorney Pish, how could this doctor be held liable if they've seen thousands of patients and this is the only time they made a mistake? However, the law is a little bit different. The law states that a doctor can only be held liable if their conduct was below the standard of care, meaning the doctor fails to use the level of skill, knowledge, and care that other reasonably careful doctors would use in the same or similar circumstances. For example, if a patient goes to the ER, the emergency room, and the doctor there sees that that patient is exhibiting all the symptoms of having a stroke, and that doctor instead sends that patient home, and the patient goes home and dies 4 hours later, that doctor can most likely be sued for medical malpractice because every other physician, every other ER physician in the industry knows that that patient should not have been sent home.
So this is absolutely true. So Attorney Pish, excellent way to describe standard of care and also causation. The term he didn't use in this short, but that's basically what he was talking about, causation and damages. So as a medical legal consulting physician, my job is really just to be a neutral party as a doctor and just to explain the situation. Whenever a med mal or personal medical malpractice or personal injury case comes to my desk, my job really is just to give the facts. I'm not really on anyone's side. I just am a neutral physician. A lot of times, every party needs a physician because a layperson wouldn't be able to explain these very complicated terms like standard of care, causation. And so I basically provide medical literature, and from my general medicine background as a family medicine physician, I can provide my own insight as to what I would do in a certain situation. But this is absolutely correct. Standard of care is, I like to describe it as what would 90% of that specialty do. So, for example, in this situation, what would 90% of emergency room physicians do for a patient who comes in with alleged and apparent neurological deficits? That's basically what Attorney Pish is getting at. And so then, even if the patient is sent home, it really doesn't matter if only standard of care is breached. There must also be significant damages, and then we can create a causation argument. So, in this situation, if the patient died, that's the ultimate damage, right? Or if you just suffer a stroke, that also leads to, you can get hemorrhagic conversion or a brain bleed, or you could just have, paresthesias, quadriplegia. You can have so many downstream effects. The term for that is sequelae. So standard of care and causation and damages, if all three are checked, that's a potent meritorious case.